Hi everyone, welcome to another episode of Body by Ravi Plastic Surgery 101. Today I wanted to talk to you guys about breast lift. Um, when patients come to the office interested in breast augmentation, in many cases what they also require is a breast lift. And the question is always, how do I know if I need a breast lift? And that is a combination of an examination that needs to be done in person. So as a woman, you have to be seen by the plastic surgeon, and so that you can be evaluated. And during that evaluation, certain measurements are taken. And there's these measurements will help dictate whether a lift is needed at the same time as an implant. On one hand, the breast implant itself will increase the size of the breast, but sometimes, in many cases, if the shape of the breast is not ideal, then an implant alone will not improve the shape. It'll just add volume or size to the breast. So you can have a larger breast that just doesn't look good. And in order to make it look good, you need to do the lift at the same time. And so these measurements that we take will help determine whether a lift is needed and what type of lift. And so we can talk a little bit more about the different scars, the different types of lift that's required. But in many cases, obviously, when we talk about lifts, patients are usually concerned about the scars associated with it. But I tell patients, it's better to have scars on the breast that give your breast a nice shape rather than just to try to get away with just an implant. And if you actually need a lift and you just do an implant, the breasts are not going to look good. And it's better to have those scars on the breast to get a better shape to that actual breast with the implant in place. So in many cases, that's the case. Now, who are the type of patients that require a lift? Well, usually women who've had children require a lift, not always, but in many cases, because the top portion of the breast is usually flat, the breast is sagging a little bit, and that's just from deflation from having had children. Also, patients who've lost a lot of weight will also exhibit a similar type of shape to the breast that will require volume to be replaced with the form of an implant and a shape, and to improve the shape with the lift at the same time. Usually women who haven't had children, in general, in those cases, just require implants only to increase the size of the breast. But in the rest of patients who have lost a lot of weight or have had children, usually a lift is required at the same time. So I hope that helps a little bit in terms of kind of determining whether you need a lift or not. But always see your friendly plastic surgeon to be evaluated in person so that certain measurements can be taken to determine if the lift is right for you. So thanks again for watching, and tune in to our next informative video.